Alright, the last priority is priority 3. If 2 and then 1 did not clear, then we would move on to priority 3. So priority 3, we are going to find our side of, obviously we would have already established our side of short leg. She has a right short leg. We're going to bring it up, knees to 90 degrees, elicit the reflex again, and check and see what happened to that short leg. So what happened to her short leg was it lengthened, and that's a positive Deerfield test. So we're going to move to the first one to check in the positive Deerfield test, and none of these have torque in priority 3. The first one is checking for an AI sacral base, so I'm going to be testing under the sacrotuberous ligament. I'm going to be touching the bone you sit on. Is that okay? Mm-hmm. Good. We check if that would balance. Say it did. We're going to be coming up under the sacrotuberous ligament, and we're going P to A, I to S, medial to lateral, just under there. That's for an AI sacral base. Okay, the next thing we check if that was not there would be a AS trochanter. So I'm going to swipe on her greater trochanter. See if that balances short leg. Say that balanced perfectly. Then we're going to come up to the greater trochanter. And we're going A to P and S to I on the greater trochanter, right there. We could add motion into that. Okay, and the next that we would check if AI sacral base and AS trochanter were not there is a PI ilium. And to pressure test for a PI ilium, we come up to the inferior aspect of the PSIS. Pressure test. See that perfectly balance the legs. Our line of drive is going to be P to A, I to S, M to L on the inferior aspect of that PSIS. Like that. We're going to add motion into it. The last one of this priority would be the superior pubic rami. So I would have the patient squeeze their knees together. Can you squeeze your knees? Good. Test. If that absolutely balances the legs, that's a screening test, and I have the patient turn onto their back. And I'd have you, can you place your thumbs in your navel and just find the bone in the front, please? Again, this would be on the side of the short leg, which is this side. All right, the instrument is actually, I'm just going to be touching that bone, okay? So we would swipe S to I on that. We elicit the reflex again and see what happens to the leg. If that is a positive test, then we're going to come in. Can you find that bone again? The instrument's going to replace your fingers in front. Good. And we're going to come straight S to I, just off the midline on the superior pubic rami. Awesome. Can you go face down one more time? I just want to make a correction to my AI sacral base line of drive. It is P to A and I to S. There was no M to L on it. So that would look like this, going between the shoulder blades. Good. And also a correction on my sphenoid line of drive. I was saying medial to lateral on these, but it was anterior and posterior when I was pressure testing there. And that's the end of priority 3.